thank you everyone for joining us. We'll go ahead and get started. Welcome to the latest Duke media briefing on the COVID-19 pandemic. I'm Greg Phillips with Duke Communications. Countless thousands of COVID-19 survivors continue to grapple with symptoms many months after they were first infected. We have two Duke pulmonologists with us this morning to discuss what we know about long COVID, as well as what we still have to learn. Joining us today is Dr. 𝐏𝐏 Giovacchini. She is a pulmonologist and critical care specialist with Duke Health and an assistant professor of medicine at the Duke University School of Medicine. Also with us is Dr. 𝐓𝐡𝐞 𝐏𝐚𝐬. She too is a pulmonologist with Duke Health and a professor of medicine at the Duke University School of Medicine. Good morning to you both.
Morning.
Good morning.
Dr. Giovacchini, we'll start with you. What do we mean when we say long COVID? What can that kind of involve and include?
Yeah, that's a great question, and actually one that has sort of evolved over the course of the pandemic. Long COVID is a term that actually came out of patient-described symptoms at the start of the pandemic, and patients who were struggling with ongoing symptoms initially after their first diagnosis that lasted weeks of time. A few different conglomerate groups have created different definitions. And so what we initially mean now when we talk about long COVID is symptoms that last beyond the 4 weeks of what we would consider the acute illness. So there are a few things that fall under the long COVID umbrella. Some societies have deemed a post-acute syndrome that lasts between 4 and 12 weeks after the initial acute COVID infection. And some guidelines have now updated to include a long COVID or a post-COVID syndrome that goes on beyond the 12 weeks of time. So for instance, the Delphi consensus that was put out by the World Health Organization does define this as something after 12 weeks after your acute infection with ongoing symptoms that can range from a host of different things that we'll discuss, that have lasted approximately 2 months after your infection and go on beyond that 12 weeks of time. That being said, that's not necessarily a consensus definition that's used in the US. The NIH is defining this still currently as anything after 4 weeks, and this is an evolving definition for us. Long COVID itself can include a host of different symptoms after the acute infection. It's usually an extension of what you had symptom-wise from your acute infection, but can also include other new things. So the most common things that we see are persistent fatigue and persistent shortness of breath symptoms. It can also include a bunch of different things like palpitations, things that we've heard referred to as brain fog, memory issues, ongoing insomnia problems, neuropathic problems, and a host of different things.
Absolutely, thank you. That is indeed a very large umbrella. Dr. 𝐏𝐚𝐬, at this point, we're 2 years into the pandemic, and what do we know about how prevalent long COVID is, or how common it is amongst people that have had the virus?
Well, when you look at the literature and when you look at what we see here at Duke, the literature quotes anywhere from 10 to 50% of patients can have long COVID or develop long COVID symptoms. I think on average, it's about 30% that's quoted. Over here at Duke, we're seeing numbers that are similar to that. If you look at, it also is somewhat dependent on the symptom that you're describing post-COVID, because if you look at brain fog, about even up to 80% of patients are quoting brain fog after COVID. So it is a burden on patients, and it's a problem that they're trying to deal with and that we're trying to help them with.
Absolutely. Thank you to both of you. There's a lot to dig into here. We are going to open it up to questions. Thanks to everyone who submitted questions in advance. You can also pose questions via the Q&A window at any time, and I'll address them to the panelists. If you would like to ask a question in person, raise your hand in Zoom, and we'll unmute you when your turn comes around. And if you're calling in by phone, you can raise your hand by pressing *9. Dr. 𝐏𝐚𝐬, I'll stay with you for a minute. You've mentioned that in the literature, the percentage of people reported to be suffering from long COVID varies greatly. Can you talk about some of the difficulties of identifying whether symptoms that somebody has a long time after COVID are in fact the tail of COVID and not something else?
Well, that's a good question, because what I'm seeing with COVID is something similar to what I see with other chronic illnesses. So if you look at diseases like Lyme disease, for example, a lot of these patients can develop prolonged fatigue, fibromyalgia, that's muscle aches and pains, difficulty concentrating, difficulty breathing. So all of those symptoms that I see with chronic diseases, I'm also seeing with COVID. and long COVID. How do you tell the difference? It's hard to know. We assess the patient when they come in. Our clinic at Duke primarily focuses on the lung effects of COVID. And so if someone comes in and they're complaining of shortness of breath or chest discomfort, then post-COVID, then we see them. And we often find that if they had some form of lung disease prior to COVID, then whatever symptoms they had before COVID have been amplified after COVID. And so I think what we're seeing is a combination of the acute effects of COVID and then the amplification of disease after they've had COVID.
Absolutely, thank you. Dr. Giovacchini, coming back to you, and as a kind of follow-up on what Dr. 𝐏𝐻𝐻 was just saying, have you guys seen that there are certain people that there are risk factors for people to have long COVID, like somebody that comes in and they get COVID among the subset of people that have had COVID? Are there any particular risk factors that seem to show people are more likely to develop these longer-term symptoms?
Yeah, that's another interesting question and another part of the literature that's sort of evolving as we follow this along. I think what people think of as historical risk factors for severe disease, so things like age, underlying comorbidities like high blood pressure and diabetes, are not actually the things that pan out in terms of risk factors for COVID. And so for long COVID. And so for some people, that's been quite a surprise when they develop symptoms later or have ongoing persistent symptoms. The most consistent thing that's been panned out so far in some of the cohort studies in the literature is the number of symptoms that someone presents with. So if somebody has, say, more than 5 different types of symptoms that they're presenting with their acute COVID infection, that may predispose to ongoing long COVID symptoms. They don't necessarily need to be the same symptoms, but that probably is something that predisposes regardless of the initial severity of your disease. So even patients who are managed as outpatients or have mild disease, but have a host of symptoms when they present, may be more likely to get long COVID symptoms in the future. It's certainly not something that means that you will develop long COVID if you have that many symptoms. It's just that that's something that we're seeing as a potential risk factor. I think the other surprising thing for some patients and people following this is that, again, it does not relate to the severity of your disease. So these patients can have had mild disease or maybe a short hospitalization and still end up with long COVID symptoms. They're also tending to be younger patients than we think of as those who might get severe disease. So while we have, again, kind of historically heard that greater than 65-year-old age group is at risk for severe COVID, patients who are showing up with long COVID symptoms tend to be on the younger end of that spectrum. So maybe in the 40 to 55 range, and even younger patients, we've seen this pan out.
Sure, absolutely. Thank you. Goodness. Dr. 𝐏𝐻𝐻, obviously one of the encouraging things, at least here in the US, is the vaccination rates are now quite high. Can you speak to whether people who are vaccinated but still get breakthrough infections seem any more or less likely to develop long COVID afterwards?
Well, we still are seeing long COVID post-vaccination. The numbers are way lower, so marked reduction in these numbers of patients that are presenting. And the patient symptom burdens seem to be different than what we see with those who have not been vaccinated. So the severity of their post-COVID seems to be reduced.
Oh, wow, that's interesting. So is it that you say the severity is reduced, they're kind of similar symptoms or they're completely different symptoms, but also...
Well, again, we're looking at a specific patient population with long COVID that have respiratory disease. And so they'll come in with respiratory disease, but when I look at their lung findings on a CT scan or chest X-ray or lung function studies, they're not as affected as those who have not been vaccinated.
Sure, absolutely, that makes sense. On a similar track, Dr. Giovacchini, we've started to see some success with antiviral medications, limiting COVID symptoms. Is it too soon to say what kind of effect that might have on reducing long COVID? And what do we know at this point about whether they may or may not do that?
Yeah, absolutely. I think that's the hope for a lot of folks, but it is certainly too soon to know if it's going to have a difference in terms of long COVID symptoms. I think the goal of antivirals is to reduce the severity of disease and reduce the symptom burden. But again, long COVID can happen in patients who may or may not have had severe disease. And so it's an area that'll be interesting to see how that unfolds in the future as more patients get treated with antivirals that are coming out.
Sure, absolutely. Thank you. And Dr. 𝐏𝐻𝐞, following up on that, I mean, obviously, as you said, the issue here is that long COVID takes time to present, and we don't have a great deal of data here. When we look out to maybe the next 2 years, how much, what are we likely to learn in the next 2 years that will make it that much easier for you guys to identify and fight these kind of infections? Are there particular learnings that you're looking for out of the next couple of years that will help, or is it just a matter of time?
We need time. So we're learning more and more about the disease every day, and we're learning more and more about how the disease might affect the different organ systems within the body. Right now, it's still in its infancy in terms of what we know about long COVID and what we know about how SARS-CoV-2 integrates itself into the host, the patient. And so I think we are looking forward to learning more about this, because maybe in addition to prevention, we can have targeted treatment therapies.
Sure, absolutely. Thank you. Dr. Giovacchini, we talked about the nature of long COVID symptoms, and this being obviously after the acute phase. Is this something that that is serious in the sense that it has a cumulative effect over a long period of time, or have we seen patients that have long COVID symptoms or a recurrence of symptoms that are just as severe, if not more so, than when they were in the acute phase?
Yeah, that's a great question. So I think the severe acute syndromes are a very different thing than the long COVID symptoms. So for some, and again, that's a subjective definition, I think, for a lot of patients, because for some patients, fatigue that goes on for months can be extremely debilitating and may be more quote unquote severe for them in terms of their daily functioning than perhaps their initial respiratory symptoms were up front. And so I think it depends on the type of symptom that the patient is dealing with. And again, like Dr. 𝐏𝐻𝐞 mentioned earlier, the rates of these symptoms that are lasting weeks for patients are in the 10 to 30% range, more like the 20 to 30% range for a lot of these chronic debilitating symptoms. And so for a lot of patients, that can be very severe in terms of their ongoing daily life, ability to function, particularly some of the brain fog and mental effects.
Sure, absolutely. Thank you. And I would add that if either of you want to follow up on something your colleague has said, then please feel free to do so. Dr. 𝐏𝐻𝐞, we've had a question come in the Q&A that I'll direct to you, and it asks, what do we know about long COVID rates in children, and whether vaccinations in children make any difference in preventing or limiting long COVID? Do we know anything about that yet?
Yeah, I'll actually turn that over to Coral, because she's been studying that aspect of it. I mean, long COVID in children is an issue, and we still don't know the long-term impact of that. Coral?
Yeah, again, I think this is something that is going to be important. And I do want to echo again on another question that we had mentioned, that the definition of long COVID is evolving. And so the hope in studying these things moving forward in both adults and children is that we get definitions set up front that are currently being defined by the NIH and the World Health Organization, so that we do have consensus data moving forward and can actually get an actual meaningful definition between these patient groups to follow long-term, so that we are all talking about the exact same thing. There are data that are now coming out of countries who had higher peaks of COVID before we did, and so have a little bit longer term data. So countries like Italy and Israel and the UK that have shown that long COVID in kids is evolving and is becoming an issue for them, with rates of about 40% of kids still having ongoing symptom effects at an average of 162 days. So in that 5.5, 6 month follow-up range. Most of their symptoms can be things like fatigue, like adults have, but are also turning into some of the cognitive effects like memory attention disorders in kids and some anxiety. Now, there has been a lot of question of this in the literature as whether or not these mental effects are COVID related or pandemic related, which is going to be a whole nother thing to figure out, especially in the children population. But it is certainly something to follow in kids, because what we've historically been talking about, again, is that this is mild disease in kids. So even the children who are managed as outpatients can have ongoing effects, and is something that parents and pediatricians need to be watching out for in the future as we follow these kids along.
Sure, absolutely. Thank you very much for that detail. We have a raised hand in the chat, so you're unmuted. Go ahead and ask your question.
Good morning, doctors. Yes, this is Will Michaels with 𝐓𝐡𝐞. I really appreciate you taking my question, and I think Greg really covered a lot of this, but I did want to kind of ask, is long COVID at this point, if I say were to come to you as a specialist, would you be able to diagnose me with say post-COVID syndrome, or is that sort of maybe framing it too broadly?
I'll go ahead and take that. As Coral mentioned, we don't have a great definition for long COVID, but it's a symptom constellation. And if you were to come to see us and you're saying, I have X, Y, and Z, A, B, and C, then we would sit down and talk to you about, when did you develop this? Did you have this prior to having COVID? After COVID, when did it start? Is it getting better? Is it getting worse? What have you done in terms of treatment or exercise or rehabilitation to get over these types of symptoms? And so, yes, I think we could diagnose you with it, as I said, because it is a very broad definition, and then come up with a treatment plan.
Fantastic. Thank you, Will Michaels. Oh, sorry, go ahead.
I just want to follow up on a little bit of what Loretta said there. It is something that we can diagnose you with and talk with you about, but another part of the definition that's evolving, right, is that we want to make sure that there's not something else going on. And so it's really important for patients to present if you have these symptoms, rather than just saying, oh, I have ongoing long COVID or post-viral syndrome, because even though it feels like it through this pandemic time, not everything is COVID. And you really want to make sure that what we're treating and what we're seeing is not something else that's maybe being masked by what you might think is COVID. And so as a part of the definition of long COVID, we've defined these things, but it also requires necessarily that you don't have something else to explain those symptoms.
And as we mentioned earlier, COVID can unmask disease. So it can be something predating, or it can be something that's being unmasked, or something new.
Excellent. Thank you both so much for that comprehensive answer. We're going to move on. We've had another interesting question come in, which Dr. 𝐏𝐚𝐬 touches a little bit on what you mentioned before, but maybe ask for some more detail. And he wonders if, in addition to the time that it's going to take to learn about this, are there any other viruses that attack the body in a similar way and that have these kind of lingering things that we might be able to learn from? Is there anything that might be of use in fighting long COVID?
There are other viruses and other diseases. With MERS, that viral illness also produced some long post-viral syndromes. H1N1, just the flu, has produced post-viral disease. There are other types of infections, as I mentioned, like Lyme disease, that produce chronic fatigue syndrome. Is not so different from COVID. So I think we can learn from this, and that's the hope moving forward.
Sure, absolutely. Thank you. Dr. Giovacchini, we know that there are lots of things that people can do to prevent getting COVID in the first place: wearing masks, remaining distance, isolating when symptomatic. But for people, we've had a question come in, for people that contract COVID, is there anything they can do on an individual level to help prevent them, to help keep themselves healthier, to maybe even prevent long COVID, in the long run?
Yeah, I think, like you mentioned, obviously prevention of infection, and then prevention ideally of the severity of the symptoms of your infection. So with vaccination is our best hope at preventing this in the first place, to not get the acute syndrome. I think what we know and what we've learned moving forward is that ideally you're taking care of your other overall general health to help you be in the best situation to recover from an illness like this. So making sure that you're sleeping well, that you're eating well, that you're maintaining a regular active lifestyle if you can, having a good foundation to start from is really the best place to prevent and treat ongoing symptoms. And even as a part of the treatment plan for some of long COVID, once we make sure that there's nothing serious that's going on that's going to limit your physiologic activity in terms of exercise, things like pulmonary rehab and physical rehabilitation programs can help with some of the ongoing muscle weakness and generalized fatigue and shortness of breath symptoms that we're seeing.
Sure, absolutely. Thank you. Dr. 𝐏𝐞, we've had another question come into the Q&A. You've talked about the treatment plan for long COVID. Somebody asked what that looks like. I dare say it varies based on symptoms, and whether there's any indication that additional doses of the vaccine could help at all with that.
That's a good question. So when you look at treatment for these patients, in general, what we are doing is we are looking at the symptom burden. We're looking at the lung physiology, the functional capacity of these patients, and looking at how debilitated they may be. We review their medications and look at whether or not they have post-viral cough or post-viral syndrome, and then try to target medications to those issues that they might be dealing with. Some patients develop fibrotic lung diseases and their lungs shrink in size. And so we follow those patients. Some of them need ongoing steroid therapy. So we target therapy depending upon what the patient has and their symptom burden. In addition to that, as Coral mentioned earlier, pulmonary rehab is an important part of what we do. And we really need to work with our physical therapists, nutritionists, and the rehab group to target a program that can help directly improve these patients' functional capabilities.
Absolutely, thank you. Dr. Giovacchini, we talked earlier about whether there were particular risk factors for long COVID. Another question we've had come in is whether there is any indication that certain kinds of symptoms during the acute phase are any kind of predictor of long COVID in the long term. I know that's pretty.
That's a great question. And I think, again, something that we're trying to identify and study as we get more data and this unfolds a little bit more. But as of now, no. And the initial symptoms that you have, again, don't necessarily need to be the symptoms that then persist as your long COVID symptoms if you do have ongoing problems. And so even if you had something like maybe fevers and chills up front, those tend to not be the persistent symptoms. Flu-like illness and myalgias, that's usually not what's going to be lasting that 12 weeks of time, but it might be that persistent fatigue and then shortness of breath, physical intolerance, even if that wasn't necessarily a part of your initial presentation. We do have some data that probably the things like the loss of smell and alteration of taste are going to be faster resolving symptoms, but for some patients that can still be debilitating weeks out, and things like alteration of taste of some of your foods can persist for months of time and be unpleasant for some patients.
Absolutely, thank you. Just a reminder to everybody, we're going to wrap up here shortly, but you can submit questions via the Q&A window. Thank you to those of you who have done so. And also unmute yourself in Zoom if you would like to ask a question that way. So Dr. 𝐏𝐞, coming back to you, one of the things you've mentioned here is that that time is is all that's going to take. And I found it interesting that you mentioned earlier that obviously when somebody comes in, you're talking about a constellation of symptoms that makes it difficult to know exactly, draw the connection. You're looking quite broadly. Do you think that diagnostically it's going to become easier to identify long COVID cases as time goes on, or does that problem not go away? The fact is that somebody comes in and there are so many things that could be causing their symptoms that it's always going to be a bit tricky to nail down whether it's long COVID. And it won't be a case of like now you can take an at-home test for the acute phase and boom, that's definitely what it is. Could that get simpler over time, or is it always going to remain a bit of a puzzle?
Medicine, a lot of what we do in medicine is trying to unravel these puzzles. I think that's a great question because we have a lot of ongoing research that's been done to help us better identify these patients. And the NIH is devoting research dollars to the development of new research platforms to help us in this endeavor. So right now, it's a broad constellation of symptoms. I suspect it's going to continue being a broad constellation of symptoms, just like when anybody presents with viral-like illness, and we have to do an evaluation. But it might be that in the future, we might have a more targeted approach to doing so. That's our hope.
Sure, absolutely. Thank you. And a question for both of you. Obviously, what we tend to see in the media is like the weird and wonderful cases. Well, wonderful, it's not the right word, but the strangest cases. Are there any particular symptoms that you guys have been able to identify that are related to long COVID that are just so strange or off the charts that you would never have expected that's kind of what would happen?
I've seen patients with sexual dysfunction with long COVID. It's not a strange abnormality, but it's odd for me because I'm a lung doctor and they present to me with sexual dysfunction and pain. Coral?
Yeah, I have seen the same, and I think that can be shocking for some patients. Again, I guess I would go back to the ongoing taste abnormalities for patients. I think a lot of patients feel like that is a very strange manifestation, even if they didn't have loss of smell or taste. Some of their favorite foods can just be almost intolerable to them going forward, and is a challenging thing we don't have a treatment for. And so can also cause a lot of weight loss problems in patients, or weight gain, depending on their taste alterations in the future.
Sure, absolutely. That makes sense. We talked earlier about brain fog, and obviously there's been a lot of reporting in the media over the last week or two. I know that you two are obviously predominantly lung doctors, but people come to you, as you've mentioned, with these symptoms you send elsewhere. Given the reporting that we've seen in the last week or two, is that something that you guys have seen a lot of and had to refer out? Or, how common is that among the long COVID patients that you're seeing?
Extremely common. Yeah. And I'm not surprised by it because we know that COVID is a vascular disease as well. And by that, I mean it affects the blood vessels within the body. And it's been shown to affect not only the large, but the small ones, and that it can cause clotting. So I'm not surprised by the changes that are being shown more recently in some of the scans of the brain. With the loss of gray matter and the ability of COVID to affect the regions of the brain that regulate memory and taste and smell. So when you look at this, we see these patients here, we refer them to neurology over here at Duke.
Sure, absolutely. Thank you. We're going to wrap up here shortly. We've had a few more questions come into the Q&A that we will try and tackle first. Obviously, the Omicron variant is relatively new, even though hopefully we've passed the peak of it here. Do we have any sense yet as to whether Omicron is more or less likely to cause long COVID, or is it too soon to say?
Yeah, I'll take that. Yeah, I think it's still a little bit too soon to say because, again, remember, we're talking about weeks after infection. And so with some definitions defining that greater than 12-week period. And so that we're still kind of following in right now as a time of when the Omicron peak was happening. And again, mild cases don't necessarily mean that you're not going to develop long COVID. And so even though people have milder symptoms, it doesn't mean that they won't develop long COVID symptoms in the future. Again, I think we're all hopeful that as milder variants come through, we won't see as much of this and it won't be as debilitating, but it's just something we don't know yet.
Sure, absolutely. Thank you. We've had a question come in from Rose Hoban with North Carolina Health News, who has said she's been thinking about the more recent connections made between Epstein-Barr virus and MS, and asked, what do you see happening over the much longer term in tracking the effects of COVID? Dr. 𝐏𝐏, can you have any thoughts on that, or either of you, obviously?
Well, I can tell you that there's concern now that COVID, at least with the brain fog issues, may put people more at risk for dementia. And so I know that we will be tracking what happens with patients with COVID and seeing what happens down the line. It is a very real concern. Duke has developed an integrated data repository for COVID. And so we were collecting this information.
Sure, absolutely. Thank you. And somewhat related to that, we've had a question asking, apparently people are getting emails from people who want to participate into research into long COVID. Is there anywhere yet that we can refer people? Is this being studied yet?
Yeah, so we are absolutely running a host of different trials that I'll let Loretta speak a little bit more to after this. But we do have our 𝐓𝐡𝐞 post-COVID clinic that patients are welcome to refer into. We get referrals both from primary care physicians, other hospitals, and patients themselves are welcome to refer. We see patients at a range of about 6 weeks out, so you should be falling into that kind of post-acute symptom time where we would expect most of your acute symptoms to have resolved. And so it's ongoing after that 6-week period. And then based on your evaluation at that appointment, ongoing symptoms, and the workup that we do to, again, make sure that nothing else is going on. So we haven't missed something else that might be a different diagnosis, or unmasked something that might be another important diagnosis to treat. After that, if we are left with this sort of long COVID symptom umbrella, there are a host of different trials that we're enrolling into through the 𝐓𝐡𝐞 system that I'll let Loretta speak to a little bit.
Yeah, so within the pulmonary division, we have studies looking at social determinants of health and long COVID. We're looking at how obesity affects long COVID. We are in the process, we have a couple new grants that are looking at developing new scientific platforms to study long COVID and the effects that it has on the immune system. There are multiple studies at Duke looking at long COVID, not just within the pulmonary division. And so if you go to the Duke Hospital website, you can look at some of the different trials that are being ongoing and seeing which one you might qualify for.
Excellent. Thank you both for that. We will add a link for people to follow into the news tip that we'll be sending out to everybody who registered for this Zoom afterwards, so you can follow up on that if you would like to. We've had another question here, and I suspect the answer will come down to time, as everything else has. But do we know yet about how long the brain fog issues might last, or whether they could in fact be permanent? You mentioned the possibility that they could increase the risk of dementia. Is that another wait and see question, or how much do we know right now?
It's another wait and see question. Again, the research that's being done right now, we're hoping it's going to help us with this and see if there's things that we can reverse.
Sure, absolutely. Thank you. We are about to wrap up here. I would like to just give each of you an opportunity, just for people who are concerned about COVID, concerned about their health in general, to remind of some things that people could do if they want to feel better about their own health, or just some simple steps people can take for COVID and otherwise. Dr. Giovacchini, we'll start with you. Any recommendations you might have for people who are concerned about long COVID?
Yeah, I mean, I think the best thing that you can do, again, is to take care of your underlying health, make sure that you do get vaccinated, and then minimize your chances of potentially contracting an illness. That's the same, honestly, that goes for all viral illnesses as seasonal viruses come through that we've known about and take care of on a regular basis. So, and again, if you're concerned, definitely speak to your healthcare provider. If you have ongoing symptoms, even if you did not have a severe COVID acute illness and you have ongoing symptoms, there are people to help you get care. And we are happy to see you in our clinic. And I think it's also important for patients to know that there are things that we can do to help you through some of the long-term effects, just in terms of rehabilitation. And like we mentioned, pulmonary rehab, if you're still having symptoms and that you're not alone in having these symptoms, it is unfortunately a little bit more common than we'd probably like for them to be at this point.
Sure, absolutely. Dr. 𝐏𝐬, anything to add?
Yes, I mean, I really encourage patients to get vaccinated because, some people think they want to let the natural immunity take effect, but I would discourage that. One of the symptoms of long COVID is headache, and I would hate to have a headache for a year if I could prevent that from occurring. So I urge people to get vaccinated and to use good hygiene, wash your hands, sleep, exercise, take care of yourself.
Absolutely. Thank you both for those concluding thoughts, and we will call a halt to it there. Thank you everyone for joining us. Thanks to our panelists, Coral Giovacchini and Loretta 𝐏𝐬, for sharing your expertise. If you'd like to be notified of upcoming briefings, please email Duke News at duke.edu. In the meantime, I've learned today that while I can only blame my brain fog on being a parent, hopefully time will tell as to how long these symptoms will be in people who have unfortunately been afflicted with long COVID. In the meantime, please stay well, get vaccinated, and like me, eat your greens this lunchtime. I will be certainly doing that. Thank you very much, everybody. Stay safe and have a